There are a lot of challenges that young people go through. First of all, from what pushes young girls into sex work.
After 2020, highly developed towns like Mbale and Barara City registered a high burden of HIV cases as compared to fairly low developed areas like Karamoja. The burden was escalated by the rise in numbers of young people secretly engaged in sex work, absence of sexual reproductive health services, and the attitude of some health workers.
We are here to offer service. We are here to end AIDS as a public health threat in this country. Ending AIDS means leaving nobody behind.
During the second National Symposium on Reproductive Health and Rights organized by UNESCO, stakeholders also highlighted some of the driving factors, which included complacence, increase in use of drugs, family vulnerability, and materialism.
Because illegal things tend to sell more. These illegal, unlawful things have a money tag on them. So they are trafficked, and when they are trafficked, they are paid more, so they take a risk.
In a deliberate move to reduce HIV infections by 2030, the Ministry of Health emphasizes engagement of risky population by extending sexual reproductive health services to them as one of the key prevention strategies, accordingly mobilizing vulnerable young people for skilling programs to empower them, as well as engaging both girls and boys in sexual reproductive health issues, have been underscored.
Everyone's effort and commitment to deal with the current situation of the HIV and SR amongst the young risk population.
Dr. Hudson Validawa, a specialist in AIDS control at the Ministry of Health, says the ministry has strategically embarked on advancing priority sexual reproductive health services to young people and the key population.
So a number of people are getting into sex work because of maybe low education, maybe low information, and maybe they aren't reached by the system. So we are trying to reach over to them and make sure that we promote for us in HIV safer sex.
Recently, the Director General of Health Services at the Ministry of Health, Dr. Henry Mwebesa, guided against discrimination at health facilities, especially among the key population, as one of the interventions to prevent the spread of HIV. Susan Naunga, reporting for ABC TV.